think it's degrading for him and for everybody, for anybody.
Roger Bass lost his life in traumatic circumstances.
He had no dignity.
He died in a crowded corridor like this, surrounded by other patients on hospital trolleys. His family are furious and want to tell his story. Happy birthday to you! Just 3 months ago, Roger marked his 90th birthday, surrounded by loved ones.
He had a great sense of humour, absolutely great sense of humour, and that's how I'm going to remember Dad.
Hooray! But rather than celebrating his long life, his family are now traumatised by his degrading death.
Absolutely disgusting. It's shameful. He had no dignity.
A proud and private man whose 9 decades came to an end in a public, crowded hospital corridor when he was rushed in with a suspected stroke.
The thing that actually shook me was the amount of trolleys in the corridor. I've never seen nothing like it. But the nurse actually turned around and said, it's always like this, day and night, every day.
Last week we broadcast this footage. Patients at Queen's Hospital in East London left for days in corridors waiting for a bed on a ward. Just days before this was filmed, Roger lay here as his family watched him take his very last breaths.
I tried to wake him up. I went, Dad, Dad. I was pushing him up and I said, he's gone, he's dead.
Honestly, I do believe if it hadn't been for me and my sister being there, they wouldn't have, no one would have known.
The former car salesman from Essex, whose passion was horses, let down, say his family, by the NHS in his final moments.
It rattles my brain, you know, to think my dad died there like that.
It's awful. Awful.
It's dreadful. There's no words.
But he's not alone. Today, a study by the Royal College of Emergency Medicine suggests almost 1 in 5 patients are cared for in corridors or waiting rooms.
The reason why I'm doing this is to highlight the problem. You know, the terrible, terrible problem that they've got, the NHS. And I would say to West Streeting, please go down there and see for yourself what it's like any day of the week.
Queen's Hospital has apologised to the family, admitting no one should be receiving corridor care. The government is promising to eradicate it.
I think it's degrading. I really do. I think it's degrading for him and for everybody, for anybody.
Should have been in a private room where his family could be around him, saying our prayers and our last goodbyes. I have flashbacks of the corridor.
Oh, yeah.
You know.
The current reality of a pressured health service that's meant to be there for us from cradle to grave. Rebecca Barry, ITV News.
Well, corridor care is a problem, it seems, right across the UK, with politicians in Wales debating the issue in the Senedd this afternoon. Carrie Davis is outside the Senedd for us. Carrie, what's been said there?
Well, the Royal College of Nursing Wales and the British Medical Association here say that the first step to tackling corridor care in Wales is to understand the picture of it by collecting some data and measuring it to really understand the prevalence. Healthcare staff at today's protest that was held on the steps here outside the Senedd, they say that they feel the practice has become normalised. They say it's a daily, year-round occurrence. Representatives from both the unions were on these steps this afternoon ahead of a debate held in the Welsh Parliament. That debate was triggered by a petition signed by more than 10,500 people calling on the Welsh Government to end corridor care. Now, doctors and nurses here say that as well as needing more beds, investment in community care and preventative medicine would help reduce the demand on hospitals. The Cabinet Secretary for Health and Social Care, Jeremy Miles, said in that debate that the Welsh Government does not not endorse routine care in non-clinical settings and that they are working on system-wide reforms to try and tackle it. But he said it is not a quick fix.